An American doctor sick with Ebola is reportedly in dire condition, barely able to stand on his own by the time he made it to a hospital in Berlin, Germany. Dr. Peter Stafford and his wife, Rebecca, who is also a doctor, were doing aid work in the Congo for a Pennsylvania-based charity. According to colleagues, Dr. Peter Stafford got sick after he operated on a man who later died from the virus. Now he's fighting for survival himself, and his wife and his 4 very young kids are all quarantined, waiting to see if they are going to get it next. That risk was made even more serious because Dr. Rebecca Stafford also treated the same patient who spread Ebola to her husband. According to the WHO, at least 139 people have died and hundreds more are sick. In the United States, the CDC is restricting travel from high-risk countries. That's the same thing they did in 2014 after a doctor returning from Africa later tested positive for Ebola in New York City, but not before riding the subway, going out to dinner, and bowling in Brooklyn. The doctor survived, but it showed the most feared virus in the world can go from the African jungle to Manhattan's concrete jungle just as fast as a 767. Former CDC Director Dr. Robert Redfield joins us now. He was director of the CDC when 3 Ebola outbreaks occurred. Doctor, it's great to have you. So the director of the World Health Organization says he's deeply concerned about the scale and the speed of this outbreak, that the numbers of infected rises daily, and he says the virus was spreading undetected for a long time.
Yeah, Elizabeth, that's all true. This is an outbreak right now that is really a significant outbreak that's of significant public health international concern. Partially because what you said, it wasn't recognized very quickly. I'm not sure why. Normally, when we had these Ebola outbreaks, and I had 3 of them when I was CDC director, all of which were in the DRC, normally we recognize them when we have 5, 10 cases, you know, most. This one really wasn't picked up till there was over 100 cases. As you said, now there's over 500 cases. There's close to 150 deaths already, and it's moving very rapidly. It's spread into Uganda already. There's concern that it may be spreading into South Sudan. So I do think this is going to be a significant Ebola outbreak.
This strain of Ebola, because there are many different strains of this disease, but this one has no vaccine and no treatment. Is that what makes the fatality rate so high, or is it something else? It's a fatality rate of 25 to 50%.
No, the original Zairian strain that I had to deal with had a mortality rate of around 70%. But
Wow.
we were able, during the pandemic, we were able to develop, not we, but the private sector pharmaceutical companies, Merck in particular, were able to develop antibodies for treatment, which reduced the mortality to under 10% if we could treat a patient. And then they developed a vaccine that could actually also reduce the mortality and the likelihood of infection. The problem with the current strain is neither the vaccine or the antibodies that were developed for the Zairian strain work. There is an experimental vaccine that's been in trials in monkeys.
We need it now.
They need it now.
Yeah. Has patient 0 been identified, and why is it so important to find whoever this person is?
Yeah, I don't think that they know who the initial patient was. You can see the real problem that happens, just like this doctor got infected. Normally what happens is the patients end up going into the hospital. They're not recognized. The infection control procedures are not as tight as they need to be. Then the doctors and nurses get infected. Frequently, the doctors and nurses then infect other patients. I had one hospital in the DRC when I was CDC director that over 70% of the patients ended up dying of Ebola, because it was spread from patient to patient to patient by the healthcare professionals.
We do know that there was a man who died in the Congo on April 20th who may have sparked a super spreader event at his funeral that was held a few days later on May 5th.
Very common. One of the procedures that caused a lot of spreading for Ebola was the custom of washing the body. And the family will all come to wash the body after somebody died. And then they would end up really infecting almost everybody that came to wash the body, and then they'd spread. So we tried hard to change that procedure, that people did not wash the body. And the problem here is they didn't realize they were dealing with Ebola. Why
does this virus periodically emerge? I mean, what are humans doing in that part of the world that exposes them to the virus? We all know, we don't know if COVID came from the lab or the wet market, but we know that there were rare animals at the wet market that people were exposed to. What's happening in Africa? Is it the fruit bats? Is it something else?
I think you're right. It's the bats. The fruit bats are bringing it. I mean, one of the things that's interesting, kids will go through the jungle and they'll see fruit that's been bitten into because the bats like to bite into the sweetest fruit. All right. And then they pick up the fruit.
And they bite it.
And they bite it, and the juice is there. The other thing that's very problematic, and we figured this out when I was CDC director, when people do get Ebola, there are some people that continue to have it for a long time.
Mm-hmm.
In particular, it can house itself in male semen. And then, then 3 weeks, 3 months, 6 months later, the man infects a new woman, and then the pandemic starts. So this is a complicated.
Wow.
This is a complicated virus. It's going to be very hard. This area that I know well, in Turia, where this outbreak is, they've been at war for 25 years.
Yeah.
There's over 25 fraction groups, and they're fighting each other. It's going to be very hard. I suspect this is going to become a very significant pandemic, probably going to leak into Tanzania, leak into southern Sudan, maybe leak into Rwanda. So it's going to be very disruptive.
Wow. Very quickly, the CDC has now banned anyone from entering the United States who's been in Uganda, South Sudan, or the Congo in the last 21 days. Is that enough to keep the virus out of the United States, do you think?
Well, it's an attempt. In other words, the nice thing, if there is a nice thing about Ebola, is that you're not infectious until you're symptomatic. So It's not like a lot of virus diseases that you're most infectious before you develop symptoms. This is a virus that you really don't transmit till you're symptomatic.
Okay.
And they're going to really restrict 21-day incubation period. They launched what we call the Title 42, which I've done when I was CDC director, which is going to restrict entry into the United States for people in those regions for 21 days.
Dr. Robert Redfield, we will hopefully have you back on the show as we track this story. It's a scary one, to be honest, and deeply distressing for that part of the world.
We should all keep the family in our prayers.
Yeah. Dr. Peter Stafford,
his and his family, because they've all been exposed, and we pray that none of them are infected.
Yeah, they were doing really good work, important work in the Congo, helping folks. All right, Dr. Redfield, thank you so much. Really appreciate it.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.